Dr. Adegbola Sesi. She's an emergency physician and founder of S.C Ethos Academy, and she sits down with us as we continue the conversation on a cesarean section. And of course, I'm here with the ladies as well. Good morning, ma'am.
Good morning.
It's so good to have you.
Thank you for having me.
So earlier, we're talking about cesarean section and the myth or misconception around it that a lot of women who opt for cesarean section are not as strong as the other women who opt for natural birth. And of course, we had to look into that. But we want to hear from you from an expert's point of view. What do you think about it?
Okay, for cesarean section, I wouldn't say that women that opt for cesarean section are not the ideal women. Because when we get to talk about, to patients about their mode of delivery, most times patients that have vaginal delivery will say they had normal delivery. However, abnormal delivery doesn't mean that cesarean section is abnormal. Normal delivery means that healthy mother, healthy baby. That is the goal of any delivery. So we want to break that notion of cesarean section being abnormal. And then another thing is the social cultural factors around cesarean section, especially in our own settings, where a woman that has delivered via cesarean section wants to keep it away from family members that she has delivered via cesarean section. So many myths around cesarean section.
People try to keep it away from family members.
Yes.
I'm honestly hearing that for the first time. I'm hearing that for the first time. And so, you know, there are pros and cons when it comes to cesarean section. And I'm wondering, for an average person, there might be a lady who is heavily pregnant, is still weighing her options, and she's thinking, is it a wise decision if she decides to do elective CS, for example? What are the pros and cons, quickly, if we could have some of them? Okay,
so for cesarean section, it could be elective, just like you've mentioned. That's the planned type of cesarean section, and then the emergency that is unplanned. Okay, so for the elective cesarean section, the lady would have been counseled about the indication. That's the reason why she's having the cesarean section done. And then usually we would tell them when we're counseling them about the complications as well. Okay, so the complication vis-a-vis, there could be bleeding. However, with every complication, we already have things in place. So one, for the bleeding, that's the reason why we tell them, okay, so group and cross-match blood, make it available. And then another thing that can also happen is the risk of infection. Okay, so in terms of infection, we get antibiotics ready, we give it to the patient, and then in terms of pain, we are ready for pain. Okay, so most times patients are being given spinal anesthesia while in theater, and then after the surgery.
That's the epidural, right?
Yes, there's spinal and then there's the epidural.
Okay.
Yes. Okay. So then afterwards, while in the ward, after the surgery has been done, we give a lot of analgesics.
Okay. I think for me, the question would now be, how is it? Because the truth is, I understand, of course, now we are here in 2026, and it's understandable why our mothers would think that, oh, okay, I mean, in our time, we did it like this, right? And then that is the way, because they'll tell you, okay, when God created the body, if he wanted babies to go coming out from here, he would have put a space there. Do you understand? Do you understand? So they believe there's a way, and then if you go anything out, you know how tradition can be, right? But my question now is, based on your experience, why would you say that the rates of cesarean section now is increasing, right? Because once upon a time, the only type of birth known was vaginal. If it was not vaginal, it was probably not happening. You'd probably lose the child, right? Now, why would you say, or would you first of all agree that there's an increase in the number of women that need to do cesarean section? And if yes, why? Is it our lifestyle? Is it what we're eating? What exactly is it? Okay,
you know, with social media, before now, social media wasn't there for people to hear so much about people having cesarean section done. So the figures were not out there for people to know. But now social media is there, and then everybody knows that, okay, this person had cesarean section and all. So with the increase in the cesarean section, so now we are more proactive in the sense that we don't want a complication to arise before we make a decision. So sometimes while we are monitoring the patient in labor, while we see that, okay, there is already imminent fetal distress, we would counsel the mother to have a cesarean section. We don't wait for the complication. So we don't wait for the complication. So that can be one of the reasons why cesarean section has increased.
Okay,
no,
okay.
Go ahead.
I was going to ask a follow-up question, sorry.
No,
because some people believe that, I mean, sometimes like some hospitals just rush into it. They don't even allow, because I mean, I've read a lot about birth, right? And it's like, okay, first of all, if the hospitals can even focus more about creating a conducive environment for labor to take its natural course, then we'll reduce the need for CS, right? But it now seems as if, okay, the doctor, before you even think anything, doctor is saying, oh yeah, you know what's prepare for CS. Do you understand? Is that true?
Okay, no. So when a woman is in labor, we monitor the woman. Okay, so there's labor care guide that we use, before now it was pathograph, that we use to monitor the woman when she's in labor. And then at some instances with the timing, because for when a patient is in the labor room, there are some hours that we give. Okay, so 4 hours, I'm going to do a vaginal delivery. I checked her prior to that time. Okay. She was 4 cm dilated. That is the cervix. That is how open it is. And then I'm checking her after 4 hours. She's still 4 cm dilated. That means there's no progress in labor.
Okay.
So that is the aspect of the monitoring.
I'm very curious about something. I've heard of cervix closing after 2 centimeter dilation. Now, I know of a story of a woman who went to the hospital, was told she was 2 cm, go home, come tomorrow morning. She comes the next day and she's told the cervix has closed. What happens in such incidents? What causes that? Okay,
so for talking about cervix that was initially 2 cm dilated and later closed. Okay, so when it comes to examination of a patient, we use our fingers to check. Okay, so and then for someone that's delivered before, there's something we call patulous os. Okay, so probably she had a patulous os, and then afterwards, when someone else was checking, she was found to have a closed cervix.
What is the patulous os?
Okay, so for a woman that's delivered before, the cervix may not go back to the closed way it was.
So that is what they so it's not civil. Okay.
So I mean, I was going to ask, right, what we're talking about is for emergencies, but let's talk about elective. There are people who, from the first day of your pregnancy, I want to have CS, and there is nothing anybody would do about that. How do you even prepare yourself, or even in pregnancy in general? Because sometimes people want natural birth, and then they change their mind. Or they just decide, I want elective CS. How do you prepare your body to ensure that it is right for you? Just like how Winfrey was saying, the hospital has to be conducive, but even your own body that's carrying the baby, how do you prepare for that? Okay,
so when we are preparing the woman for elective cesarean section, she has to be, one, physically ready. That means we take all the investigations we have to do for her. We make sure that her blood level is normal. If it's low, we'll prep her up by giving a blood transfusion. Okay, then we also want to psychologically prepare her, especially for first-time moms. It's not easy.
That's what I'm asking.
Yes, so first-time moms, it's not easy for them to have the cesarean section, because the most questions that they ask is, hope it won't be painful. Okay, so we have to physically...
Is it painful?
Okay, so talking about pain with cesarean section, while in the theater, we give the spinal anesthesia, so she's probably not feeling anything.
But afterwards,
she'll feel some form of pain. But the analgesics will take care of that. But she will still feel some form of pain.
But she has to be on the meds for a while, right?
Yes.
Interesting. So you're talking about preparing.
Okay, yes. Okay, so talking about the psychologically preparing the woman as well. And then also, we also want to let her prepare herself for postpartum stage, because the postpartum stage can actually be stressful for her, especially for first-time moms. So we want to prepare her in terms of pregnancy, the delivery, and then the postpartum.
Final question quickly.
The S.C Ethos, just tell me, what is it about? Because I know you teach people emergency care and all.
Yes, okay, so S.C Ethos Academy was founded in October 1st, 2025. It's an academy where we train children between the ages of 4 and 12, emergency response. We teach them what to do in a setting where their parents are not available to help. So I'll give an instance. Siblings are together, and then a younger sibling choked on granules. So we teach them what to do for a choking child. We've taught them about first aid, bleeding, burns.
Beautiful. We have to go now, but I just want a yes or no answer. Who should sign the consent form if a woman wants to do CS, especially if it's an emergency?
Okay, the patient can sign, and the next of kin can sign.
And the next of kin.
The patient can sign.
You heard it from a doctor. The patient can sign.
Yes.
Thank you so much for your time, Dr.
Thank
Sesi.
you.
Thank you so much.